Welcome to Health Talk Live Talk Show. Health is wealth, precaution is better than cure. On that note, I would like to invite my guest and co host for today's show, Dr. M.S. Cover. He's pulmonary and critical care specialist and senior member COVID team. And friends, his book on COVID 19 is about to publish, and we are so happy. So, on that note, what I've been telling you about COVID 19 and about your health precautions, let's invite Dr. Cover. Hello, Dr. Cover, how are you?
Hi, Rashmi. All well in this part of the world, but we are still facing a huge deluge of COVID cases in Delhi
Yeah.
and in India, but Delhi is particularly heavily involved. So is your country at this time also, especially Texas, California, Florida,
New
mm,
Jersey,
Chicago area,
New York.
Michigan,
Yeah, yeah.
and New York still. So the problem is still rampant, and I mean it is shocking. I mean you couldn't have believed that the world would have lost 1.35 million
Yeah.
people by
That's very
now
sad.
to
Yeah.
one disease so rapidly and so unpredictably. And the total number of cases have been 5.55 million, 5.5 crores
Yeah.
worldwide. USA itself is has gone to some like 11.4 million.
Yes.
Just imagine, and 2.5 lakh, 2.5 lakh deaths in USA. I mean, this wouldn't have been taken kindly by any president or any political party, and no surprise that the political parties were so keen on seeing that the vaccine to be given before the elections. That
Yeah.
probably they thought could have altered the political fortunes of Donald Trump. Anyway, the point is, same is the story in India. 9 million cases so far. 9 million cases so far.
I know.
1.3 lakh deaths. And in Delhi itself, the number had almost touched 10,000 a day. It's now come down
Yeah.
to some like 5 to 6,000, and we are still feeling okay, oh, a little relief. But then, earlier record was some like 4.47 hundred new cases in a day. That was earlier on, and suddenly in November the number started jumping. Well, call it festive season, people becoming reckless, or you may think in a different way, like I think the pollution has probably allowed coronavirus to take a piggy ride on the dust particles, the which form the bulk of the protein, kind of you know which carry sulfur, nitrogen, carbon dioxide, monoxide, and then there is a ultraviolet rays causing more chemical reactions, and corona does a piggy ride on them
Mm-hmm.
when there is a heavy pollution. And that is probably one of the reasons that suddenly there was a spurt of cases in the last few weeks, 3, 4 weeks or so, since the pollution effect started. So the temperature, the humidity, and other things, dry climate, a little cold climate is what increases the possibility. And this is probably what has happened in Europe. This is what has happened in UK.
Yeah.
Not the pollution, but the temperature effects, which has brought in the disease all over again, as you may call it, second wave, third wave, or whatever.
Actually, yeah,
So
absolutely. And doctors were expecting
this,
second wave. Before also there were talks, like it was talk of the town that second wave will be there.
they
And
were they were worried about the winter
yeah.
effects,
Mm-hmm.
and they are seeing that now.
Yeah.
Anyway, let's go to our topic for today. And I have two very illustrious colleagues of mine and very old friends. And in fact, whenever I need help, I refer cases to them.
Mm-hmm.
Dr. Sandeep Upadhyay is a rheumatologist for a long time in Apollo
Welcome
Hospital.
to the show.
And Dr. Yatendra Kharbanda is a very technically very fine surgeon, and he deals with the joint surgeries and all the orthopedic problems. There are many colleagues of ours, but he's one of the finest.
Welcome to
So
the show.
that is what we have today, and welcome to the show. And we'll today be talking about the common problem, the muscle aches, the body aches, the joint pains, knee joint, hip joint, and general body aches, which is always there. And as you grow older, you are faced with them. You can't avoid them. And so we have two gentlemen here who will like to talk about some of those issues. And if you have any questions, please feel free to ask. And Rashmi will help us communicate with you, and they'll be too glad to answer. Let me start with you, Dr. Sandeep. Let's start with the physician's perspective,
Sure.
because surgery हो गया तब तो अल्टीमेट हो गया ना. सर्जरी से पहले क्या कर सकते हो आप, वो हम देखते हैं पहले.
End of the day,
So
precaution is better than cure. That's what it
yeah,
is.
yeah. And Sandeep, we always talk about muscles, tendons, and ligaments, but then um, in rheumatology, there is a lot of internal organs which are involved, which people generally don't talk about. They only talk about what gives them pain, but what doesn't give them pain, but causes other problems, internal problems, whether they are autoimmune diseases or whatever. So they are the things which I want you to talk about. And also I want you to talk about what are the general conditions people come with: rheumatic pains, aches, arthralgias, arthritis, and what kind of arthritis you are generally dealing with. And, what are your common day-to-day issues that people come to you with?
Yeah. So I'll start with the last question first, because it's a very clean perspective. मतलब words I use एक तरह से सारे that is
Dr. Padya, your voice is not coming
There is
clear.
a problem. Yeah, there is a problem with the voice.
Yeah, it's not coming that clear. We're not able to hear him. Till that time, can we continue with Dr. Kharbanda?
अभी आवाज आ रही
अब आ रही है, yeah,
Yeah,
perfectly all right.
it's now. It's good now.
We are good.
I'll hold it in my hand because the speaker is. सबसे बड़ी बात ये होती है कि से grapple करता है. Person who gets a
We
your
do have
speaker,
network issue.
Sandeep,
No, the voice
your
is not
speaker
clear.
has your voice was much better. Can you try to bring the speaker closer or something? Or you have a earphone?
Unfortunately, it doesn't accept a earphone. Can you
Yes, we can reconnect, doctor. We can reconnect.
Yeah.
Yes.
If in the meantime, if you can use a speakerphone, that would be a much better option.
go ahead with
Okay, Yatendra. So tell me the usual kind of cases that come to you in the OPD, and then we'll talk about your surgeries, arthroscopy and stuff. But what are the usual run-of-the-mill cases who come to an orthopedic surgeon?
Good morning to all of you, and thank you for invitation. Most of our cases are neck pains, back pains, and knee pains. This is because most of the load that our body takes is over the neck, because we are sitting over the computers, एक ही position में काम करना all the time. That causes fatigue of the muscles of the neck, and we get neck pains. And then the second thing is the lower back pain, because again, most of our jobs are sitting jobs. Computer, executives, bankers. So ये दूसरी problem है of back pain. Pains because mostly our posture gets bad. We are sitting for long times. We can't sit erect for a very long time, and the muscles they get fatigued. And the third thing is knee pains that we come across. Arthritis of the knee is a very common problem, and it's going to be a big problem in days to come, in months and years to come. So these are three most common things, other than general aches and pains, bone weakness, which generally causes pains all over again. Neck pains, back pains, knee pains are associated with bone weakness also, which we call osteoporosis. तो ये सारी problems जो हैं ये बहुत common चीजें हैं. Other than that, of course, shoulder pains, ये जो होता है frozen shoulder जो बोलते हैं, ये काफी common चीज है. Ankle pains, again because of deformity of the ankle, deformity of the knees. So ये सारी common problems हैं. Overall, I think neck pain, back pain, and the knee pains take the major chunk of our common problems.
Yatendra, would you talk a little bit about the neck pain? What is your usual general advice?
See, neck pain need not be only cervical spondylosis, what we call, disc problem. That happens in a later age, but a lot of younger people are getting nowadays neck pain, and that is because their posture is bad. They starting from students, they sit with the neck bent like this. They have hours on a mobile phone, laptops, then even reading in a bad posture. So neck, if it is bent for a long time and if it's in a one single position, obviously the muscles will get fatigued, and that is what causes pain in younger people. Later on, once these postures and lack of exercise, we don't do exercises properly for the neck, muscles of the shoulders, then the next part which gets affected is the discs. The discs are basically shockers between the vertebrae, and they get worn out. Like our knees they get worn out. Similarly, the discs of the back and neck get worn out because there's a lot of load coming on them. They are not protected by your muscles because muscles are fatigued, muscles are weak, they are not exercised. So then they start getting these problems. And in older age, the discs are so much degenerated that the nerves start getting pressed. They start getting compressed, and the nerves which go in the arm and the upper limbs, then they start getting pain down the arm. So this is how different age group people present to us.
So what are the precautions they can take, doctor? Viewers are watching our show and they are very curious to know that कैसे बचा जा सकता है इस परेशानी से.
See, as I said, once you know the reasons, you can take care of the reasons. The first and foremost reason is your posture. Posture has to be right. That is why a lot of people nowadays, when they're working on computer, they've raised their screens, screens to the level of their eyes, so that they don't have to do all the time like this.
Yeah.
One is that, the posture. Second is, repeated exercises. You don't have to sit in one posture for a very long time. You should not, although your job demands it, but you should keep on changing position. You can, intermittently after every half an hour or 1 hour, you can just move your muscles a little bit, like, move your neck a little bit like this, do a little bit of exercises of the shoulder, just to break the monotony of the muscle in one position. And that is very important. And these exercises should be done at other time also, when you wake up, or when you go back in the evening, whatever time is suitable. One should do exercises to keep their muscles fit. If their muscles are fit to do the job, then you should not have problems. Third, of course, is nutrition of the muscles, bones. So proper calcium, vitamin D, minerals, proteins. These are the important things. Nowadays, the nutrition has gone for a very bad 6 sort of thing. um, all kinds of fast foods, junk food,
Yeah.
preservative foods, frozen foods. All these are bad. These all, they make muscles weak. They increase the uric acid. These harm our joints. They are inflammatory foods. So they bring about inflammation, and that is what is arthritis. That is what is spondylosis. So they not only do it in the neck, they also do it in the back. They also do it in the joints, uh, mainly the knees, hips. So these are the basic precautions. So it's basically a good lifestyle. There's nothing very hi-fi about this thing.
बट
Whatever
आज
has
की
been taught
जितनी
to us.
भाग दौड़ है डॉक्टर, उसमें मैनेज करना मुश्किल हो जाता है लोगों के लिए. दैट्स अ वेरी कॉमन
No,
प्रॉब्लम. एंड
these are the simple steps. The simple steps being keeping your posture right, exercising your muscles, and eating right food. I mean, these three things I'm sure we can do. I mean, we
Yeah,
all get
of
up in the
course.
morning, 15 minutes of exercise in the morning, 15 minutes in the evening. That's all it needs. And while you are in the while you're doing work, you can always take a break of 2-3 minutes in between. If not every half an hour, at least every 2 hours, 3 hours, so as to just relax your muscles, exercise them. And these are very practical exercises which can be done anywhere, whether you are in the office, whether you are traveling, whether you are on vacation, anywhere they can be done.
Yeah, Yatendra, these days in many corporate institutions, this is encouraged actually in the offices. And now that the people are working from home, it gives them all the more opportunity. In fact, there are certain do's and don'ts, even for people working from home, where they encourage them to break and for an exercise schedule every couple of hours. So this is exactly what you're saying.
Yeah, most of the corporates or even offices, they have gyms now,
या
Yeah.
where people can just go at their own convenient time and do a bit of exercises. So they don't have to then depend, even those people who leave early in the morning for their office, come back late. They can still do exercises during
Yeah.
their office hours.
Yeah.
So these
Thank you
things
so
should
much,
be.
Yatendra. It's been so informative, so informative. We've got Dr. Sandeep Upadhyay back, and hope not have a voice interruption now. Sandeep, we were just starting to talk about what kind of OPD cases you get as a bulk of cases. That most of cases come to you for help. What kind of those problems they come with? No, we still have the same problem,
या
Sandeep.
Let us get him back, and till that time we can continue with Dr. Kharbanda.
All right,
I may be
Yatendra,
able to
coming back.
I may be able to answer a bit of what you asked.
Yeah, please do, please do.
Because a lot of our patients, they think if it's a joint problem, they come to us,
Mm-hmm.
orthopedic surgeons. And a lot of them don't know that this is a specialized branch, rheumatology specialty, where those people deal with joint pains due to rheumatism. Um, so Sandeep probably would get in his OPD a lot of people who would have swelling of the joints.
Right.
I think he's back.
Right.
Sandeep, why don't you answer
Can
this?
I, if this time round, can you
Yeah,
hear
yeah.
me?
Now
You're
it's fine.
good,
You're
doctor. Yeah, very good. And please keep it horizontal.
So,
continue and
so
don't stop. You might again have another break. You please continue now.
right. Extremely
Keep it
sorry about
horizontal,
the.
please.
I think the horizontal thing is making
Perfect.
the sound go away.
Or no,
Yeah,
you're
Is it?
good. You're
no,
good.
this is fine. This is fine.
Yeah.
This is
So
fine.
one of सबसे जरूरी ये चीज है समझना, रेड फ्लैग्स जो हमारे ओपीडी में पेशेंट्स आते हैं, 50% ऑफ द टाइम दे जस्ट हैव अ कंडीशन, दे डोंट इवन हैव अ डिजीज. और जो वो कंडीशन डॉक्टर यतिंदर बता रहे हैं, किसी को बैक पेन, किसी को नेक पेन,
जी.
हल्का फुल्का घुटने में पेन है, so they are those people who think that they have a disease. That's a bulk 50%, and many a times it's actually just mild regional myofascial pains. जो जो अदर 50% है, जो कि जिनको रियली वॉचफुल रहना है, वो हमारे जो आर्थराइटिस वाले इलनेसेस हैं, जिनमें इम्यून डिस्टर्बेंस से आर्थराइटिस मतलब जॉइंट में स्वेलिंग, जॉइंट में पेन, रूमेटॉइड फैक्टर पॉजिटिव, या फिर ऐसी बीमारियां जिसमें स्पॉन्डिलाइटिस जो स्पाइन के जॉइंट्स हैं या हील के कुछ आसपास के जॉइंट्स हैं, उनमें अगर कोई दिक्कत होने लगती है, वो चीजें दे आर more severe and they have specific treatments. They are the kind of red flags to watch out for. उसमें क्या देखना है कि अगर आपके जॉइंट्स में सूजन हो और वो सुबह के वक्त इन्फ्लेम हो जाए और इतना टाइट और स्टिफ रहे कि आपको घंटे भर तक स्टिफनेस हो रही है। जनरल प्रॉब्लम्स में जैसे सुबह उठते ही घुटना या नेक थोड़ा सा टाइट है, गैस ऑन करने के पहले कुछ हाथ कड़ा हो गया है, 5-7 मिनट लगा उसको फ्री होने में, ब्रश करने में थोड़ी देर दिक्कत हुई लेकिन 5 मिनट बाद सब ठीक हो गया, वो बहुत कॉमन प्रॉब्लम है। वो 50-60% लोगों में देखने को मिल रही है और वो एक माइल्ड किस्म का नॉन स्पेसिफिक आर्थराल्जिया कहलाता है, जिसमें बहुत ज्यादा चिंता की बात है। वहां पर हम लोग जनरली कुछ टेस्ट करके या एग्जामिन करके पेशेंट को रिएश्योर कर देते हैं कि भाई आप बहुत चिंता ना करें, ये आपको बहुत कोई मेजर चीज नहीं है। इसमें हम लोग उसको वेट एंड वॉच पॉलिसी, जो बाकी 50% है, कुछ वैसे लोग हैं जो बहुत यंग एज में, the young mother, for example, who starts to have joint pains and all these joints become stiff, they start to look swollen, उनका रूमेटॉइड फैक्टर पॉजिटिव आता है, वो एक अलग स्पेशलिटी या एक अलग डिजीज वो है जहां पर स्पेसिफिकली दवाई लेना बहुत जरूरी है। उनको रूमेटॉइड आर्थराइटिस नाम से बोला जाता है। यंग आदमियों में, यंग मेल्स इन देयर 20s अर्ली 30s, एक खास किस्म का बैक, नेक और कूल्हे का दर्द है जो ज्यादातर डॉक्टर खरबंडा के पास जाते हैं और वो चीज को रीड करते हैं कि नहीं ये तो इम्यूनिटी वाली बीमारी है, इसमें जो है पेशेंट को हमारे पास कोई सर्जरी इसमें नहीं करना, इसमें बल्कि कुछ खास दवाइयों से ठीक करना। वो उसको प्रॉपर्ली डायग्नोज करते हैं, कुछ ऐसे टेस्ट जैसे HLA-B27 ऐसे कुछ टेस्ट करके वो उसको सही डायग्नोज करते हैं, MRI से करते हैं और फिर वो हमारे पास भेजते हैं। हम लोग उसको फिर प्रॉपर दवाइयों से, आर्थराइटिस की पर्टिकुलर दवाइयों से ट्रीट करते हैं। सो बाय एंड लार्ज ये जो स्पेक्ट्रम है मस्कुलोस्केलेटल डिसऑर्डर्स का, ये बहुत ही वाइड है एंड इट रेंजेस फ्रॉम वेरी इनॉक्वस इनोसेंट लुकिंग एक्स एंड पेन, कोई एक जगह हो जाएगा जिसको रीजनल मायोफेशियल पेन या रीजनल जॉइंट सिम्पटम्स बोलते हैं, टू समथिंग मोर सिवियर व्हिच इज रूमेटॉइड आर्थराइटिस, स्पॉन्डिलाइटिस, और समवेयर इन बिटवीन जो कि करीब करीब हम सबको हो रहा है एज वी एज, एंड दैट इज ऑस्टियोआर्थराइटिस। और वो चीज डॉक्टर खरबंडा देखते हैं जब वो कहते हैं कि भाई अब हाँ इसमें अब दवा नहीं काम करेगी, इसमें सर्जरी कराइए, और जब तक दवा काम कर रही तब तक मैं देखता हूँ, उसको दवा से ठीक करता हूँ। So that in brief is what my area of specialty is.
And Sandeep, how often do you think physiotherapy helps in them?
I think physiotherapy helps everybody. In the true sense, we are all one way or the other musculoskeletally challenged. अभी हम लोग जैसे बैठे ही हैं, हम बड़े awkward posture में मुझे अपना फोन उठा के इसको फेस करना पड़ रहा है. So if I do this for half an hour, 45 minutes, I'll have some pain. So unless I do something to make it go away, the muscle spasm, the pressure on my muscles, and I put some form of strengthening exercises or stretching exercises, वो चीज थोड़ी सी सुबह तक carry forward हो जाएगी. So in a way, everybody needs a little bit of physiotherapy. And physiotherapy doesn't mean कि वो physiotherapist आके कराए तभी वो physiotherapy हुई. वो आप एक सिंपल स्ट्रेचिंग एक्सरसाइजेस या एक जो आप इंटरनेट पे देख लें कि भाई हमारा शोल्डर स्टिफ हो गया है, उसके लिए क्या चीज हम कर सकते हैं, वो एक छोटी सी टॉवल पीछे रख के दोनों हाथ से इसको पीछे खिसकाने की सिंपल एक्सरसाइज भी एक फिजियोथेरेपी हो गई. तो बाय एंड लार्ज जो रियल आर्थराइटिस और इम्यूनिटी वाले पेशेंट्स हैं जिनमें अच्छी खासी स्पॉन्डिलाइटिस है, जिनमें इतना डैमेज हो गया है जॉइंट में, या जिनमें लिम्प आ गया है घुटने में, या स्पाइन में डिफॉर्मिटी आ गई, उनमें बहुत जरूरी. और हमारे आपके हल्के फुल्के वाले मस्कुलोस्केलेटल प्रॉब्लम्स में इम्पोर्टेंटली है. So over to you.
Yeah, and Sandeep, do you also have infectious or environmental factors playing some role in that?
इन्फेक्शन तो ज्यादा नहीं, बहुत रेयर ऐसा होता है कि हम लोग we see this medical condition called tuberculosis affecting the joints. We sometimes see a lot of patients with chikungunya, which is an infection,
Oh.
bring on a form of arthritis, but that is really not a chronic form of arthritis, so that goes away. Similarly, a lot of these things are more to do with bad habits like smoking rather than infection or just plain pollution. It is more related to tobacco use, and this is something that I want to reiterate to all our listeners here, that the most important stressor for immunological joint diseases is smoking. It is also the gender and some genetic factors. तो जैसे लेडीज में उनके फैमिली में रन करता हो आर्थराइटिस बहुत सालों से, या कुछ लोगों के फैमिलीज में इतना होता हो कि वो चीज ये इतना डिस्टर्ब करे कि पेशेंट को हर तरह की दवा में काम करे, तो उसमें दिक्कत होती. But smoking has now been shown to be related directly to arthritis and a worse form of spondylitis which doesn't respond.
Wow, that is a news to us.
Yeah, it's very informative. Our viewers are really enjoying our
Yes.
show, and they are just texting us non-stop, and we are having call in our studio. They're very happy, and it's really very informative, Doctor.
Before I go to the next question, do you have any questions, Rashmi?
They want some information about sciatica also, if we can get some information about sciatica,
Sciatica.
like when they know that they
Sciatica.
are having this problem.
Okay. So, gentlemen, anyone on sciatica?
The sciatica problem,
Yatendra.
Sciatica problem is basically irritation of the sciatic nerve. Sciatic nerve is it starts from the back, goes at the back of the hip joint, back of the thigh, back of the leg, right up to the foot. So there are different components. There are different nerves which come from various parts of the spine and goes down. So whenever there is a disc problem or whenever there is a lumbar spondylosis which has caused sort of narrowing of the nerve space, we call it as there is a nerve canal through which the nerve from the spinal cord comes out of the spine and goes into the leg.
Oh.
So this sciatic nerve, when it gets compressed due to any reason, then it causes pain down the leg. That is called as sciatica. Now, sciatica can be due to many reasons. Most common reason is disc problem. And so initially when the disc is worn out, a person gets back pain only. And when the nerve starts getting pressed, then they get pain down the leg along with the back pain, and that's called as a sciatica. So sciatica is a more advanced form of lumbar spondylosis, and that is what is nerve pain.
My viewer, she's texting me that she has the sort of pain.
Sorry.
No problem, doctor. That's fine. अभी जो वक्त चल रहा है आपका, आप लोग हमारे लिए वक्त निकाल रहे हैं. It's great actually. I know we are with family and it's fine. So वो ये जानना चाहती है. She has this problem actually. She's having some pain in her back and she's saying can she go for some test and can you suggest her something so that she can confirm that is she having this problem or not.
If there is a pain in the back and the leg pain, then the only test which will tell us exactly what is happening to the nerve is an MRI scan of the lumbar spine.
Okay.
So that tells us everything, whether it's a disc problem or whether it is the nerve canal which is got narrowed, जिसकी वजह से nerve press हो रही है, or if sometimes there are other reasons for the nerve pressure. There are many reasons, which all will get clarified in a MRI scan, and then the doctor should be able to formulate the treatment.
So MRI, she can go. That's the first step you are suggesting, right?
Yes, that's correct.
Can I intervene a little?
Yes.
मैं उन लेडी को ये भी कहना चाहूंगा that most back pains and even mild forms of sciatica, they respond to just anti-inflammatory and taking some right exercises. So there is a very good chance that a simple X-ray will help us exclude serious forms of spinal disease. मतलब कोई ऐसी चीज जो अपने आप वैसे भी ठीक हो 2 से 3 महीने में ज्यादातर शाइटिका ठीक भी हो जाती है।
जी
बहुत बार आजकल डॉक्टर्स एमआरआई के यूज को कट डाउन करने के लिए, और ये जो फोबिया बन गया है कि हमारा बहुत सीरियस इश्यू होगा बैक में, शाइटिका कभी न कभी थोड़ी माइल्डर फॉर्म में सबको होता है, और महीना 2 महीना हम लोग वॉच कर लें और सिंपल दवाइयों और एक्सरसाइज से काम कर लें तो it gets better in 90-95%. It is the 5% which are so difficult to manage. They are not able to manage. जिसमें पाँव में झंझनाहट पैर के अंगूठे तक जाए, या पैर में कमजोरी होने लगे, या कुछ ऐसे खास चीजें जो डॉक्टर खरबंदा पेशेंट को लिखा के उनके कुछ खास रिफ्लेक्सेस देखते हैं, उस स्टेज में तो डेफिनेटली एमआरआई या सर्जरी की जरूरत है। सो हमारे व्यूअर्स इस पे इतना ना डरें कि बैक पेन तो हम सबको ही है,
जी
और वो बैक पेन सबके दिमाग में आ जाएगा कि ये शाइटिका ही है, और अगर ये शाइटिका है तो हमको मजा ही कराना। तो ये भी ना होना चाहिए। और ये जरूर देखें कि एल्डरली लोगों को, खास करके 80-70 इयर्स के जो हमारे एल्डरली ग्रैंड पेरेंट्स हैं, पेरेंट्स हैं, उनको बैक पेन हो तो उनमें जरा सा भी वेस्ट ना करे टाइम, डेफिनेटली एक्सरे, थोड़ा सा भी और हो तो एमआरआई।
थैंक यू सो मच डॉक्टर।
All right. While your phone is still working, Sandeep, I would like to touch on gout. Tell me, we have a very dear friend on the show here who suffered from gout recently, and he had problem with his toe and had difficulty even walking. So, what kind of gout related toe inflammation, which sometimes make you even difficult to walk, and what is the best way out? If the uric acid is high, so what are the best ways you advise them to get rid of this problem?
Well, first and foremost, a typical gout is the one attack that happens at night. The patient has gone off to sleep, wakes up with a severe pain or a kind of stabbing, burning pain on the great toe, and many a times around the ankle area or the foot area, not the great toe, जिसको हम पैर का अंगूठा बोलते हैं,
जी
not that entire. So it's a misconception to always look for the great toe. Sometimes it may affect the knee first and foremost. आपका घुटना एकदम, आप सडनली रात में उठे एक दिन अचानक,
so he's back with us.
I think the
No problem,
there
doctor. आपकी
disturbance.
presence बहुत मैटर करती है हमारे लिए. No problem. Our viewers are really enjoying the show. कोई बात
Sandeep,
नहीं. It's a
Sandeep, even in horizontal position, you are looking very good. You can carry on.
All right, so sorry. I think I'm getting regular calls on my phone. I'm cutting that, so maybe it sort of disturbs. So उस कंडीशन में पेशेंट कई बार ये बोलते हैं कि पेन इतना सीवियर है कि पंखे की हवा या वो जो चादर है मैं उसको अपने पैर से हिला नहीं पा रहा. That's typical of gout, and there is the redness around that area, foot पे and toe पे, और वो चीज इतना सीवियर होती है कि पेशेंट को अगर ऐसे 2-3 अटैक पड़ जाएं और वो गाउट एस्टैब्लिश हो जाए तो उसमें ये जरूर करें कि लाइफ लॉन्ग गाउट की थेरेपी लें, डॉक्टर से मिलते रहें, सिर्फ यूरिक एसिड लेवल पे ही ना जाएं, बहुत बार उससे रिलेटेड और चीजों को भी देखें, जैसे प्रॉपर शुगर कंट्रोल, वेट रिडक्शन और ऐसी चीजें जो जनरल हेल्थ को ठीक करें. और डाइट जिसमें ये जो मिसकंसेप्शन है कि प्रोटीन नहीं खाना, दैट इज इनकरेक्ट, एंटायरली इनकरेक्ट. It's actually a few things that are to be avoided. One of them is maybe red meat and organ meats, the use of cola drinks, fruit juices, and too much of alcohol, especially beer. Binge drinking. So इन चीजों को छोड़ के बाकी दालें खूब खाएं, पनीर खाएं, सब्जियां, दही, दाल सब खाएं. जो मिसकंसेप्शंस गाउट को लेके या यूरिक एसिड को लेके अभी हम लोग के पूरे दुनिया में है, वो these food related misconceptions. वो हम लोग को बहुत जरूरी है to widely disseminate, to let people know that it is not the food alone. The food is one trigger for the inflammation, but even thin people who don't take a lot of meat, who don't take a lot of paneer and protein stuff, can get gout. And they're the kinds who are elderly, are using some form of medications called diuretic medicines, are having heart disease, diabetes, and have this entire spectrum of problems. So, keeping that in mind, having your doctor, your primary care physician, also involved and engaged in a dialogue with the rheumatologist. जब एक दो बार अटैक पड़ जाए, rheumatologist के पास जाएं. बहुत बार वो लोग उस फ्लूइड का टेस्ट करके क्रिस्टल के लिए, जिसको गाउटी क्रिस्टल बोलते हैं, उसको देखेंगे. And if it is positive, you have to probably continue for lifelong the right kind of medicines.
And this is happening with vegetarian people also. Like आप जो कह रहे हैं चीजें avoid करें, but जो vegetarian हैं उनका क्या करें? It's a very common problem here.
So it's a misconception that, if I remain vegetarian and I don't eat dal, and I'll be all right. And that has been a problem with a lot of patients who've allowed their gout to continue march on. They keep, going thinner by the day. They lose muscle, and they don't know that the age-old remedy for gout, so quote unquote, stop all proteins,
Yeah.
stop meat, is incorrect. Organ meat should be avoided. Small amounts of meat should be taken and indeed are good. Egg white is good. ऐसा नहीं कि आप eggs बिल्कुल ही ना खाएं. और पनीर और दालें जरूर खाएं. So this again is part of the entire process of misconception and poor reading of a disease, which causes more harm than good.
Yeah, thank you. It's a very, very informative discussion, and Sandeep, I mean, especially about the diet and this misconception you're clearing. It's so. I'm sure the listeners are actually, the viewers are able to take home a lot of good messages out of this. Finally, let me get back to Yatendra. Yatendra, I just want to know about your arthroscopy techniques. I mean, what do you normally do in arthroscopy? I know you can remove the cartilage, the broken cartilage, the pieces of cartilage. You can suck it out, those things. But how do you repair the cartilage? How do you repair the ligament? Please tell us.
See, arthroscopy जो है, it is basically putting in a telescope in any joint. We can do it in any joint. Most commonly, जो joints हम करते हैं वो है knees, shoulders, but it can be done for the hip also. It can be done for the elbow, wrist, also ankle also. But majority of them are trained in knees and shoulders. So knees की अगर बात करें हम, तो knees में cartilage होता है, ligament होता है, अंदर का tissue होता है. So arthroscopy can be done for lot of reasons. पहले तो जब हमने start किया था 80s में arthroscopy, तब तो हम सिर्फ जांच के लिए करते थे, that is to diagnose. Today we are doing mainly for surgery, because जांच के लिए तो MRI scans हैं, other tests हैं. So surgery में जब हम meniscus कभी फट जाता है तो उसको या तो निकाल दिया जाता है और या फिर हम उसको स्टिच करते हैं. अब स्टिचिंग के लिए कुछ टेक्निक्स होती हैं, थ्रेड के साथ ही स्टिच किया जाता है, और वो जो कार्टिलेज जो अंदर नी जॉइंट के अंदर से जो फट जाता है उसको वो पार्ट में स्टिच कर देते हैं. पर उसके कुछ इंडिकेशन होते हैं. सब मेनिस्कस, सारे मेनिस्कस को स्टिच नहीं किया जा सकता. लिगामेंट जो होता है जब वो फट जाता है तो लिगामेंट हम या तो सिंथेटिक लिगामेंट, बट मोर कॉमनली नाउ मोस्ट ऑफ द टाइम वी टेक नेचुरल मसल्स. जो जिस पेशेंट का हम कर रहे हैं उसी की मसल का लिगामेंट बनाते हैं और वो उसी पोजीशन में वहां अंदर फिक्स कर देते हैं विद सम स्क्रूज और स्टेपल्स. और ये सब किया जाता है आर्थ्रोस्कोपिकली, मतलब टेलीस्कोप के जरिए. नी जॉइंट में कट वगैरह लगाने की, बड़े कट लगाने की जरूरत नहीं पड़ती. पहले तो हम ओपन करके किया करते थे, पर जब से आर्थ्रोस्कोपी आया तो हम उससे कर सकते हैं. सो उसका एडवांटेज वही रहता है कि अगर ज्यादा कटिंग ना हो, इन्फेक्शंस नहीं होते, स्टिफनेस नहीं होता, पेन नहीं होता, पेशेंट रिहेबिलिटेट जल्दी होते हैं, एक्सरसाइज उनकी अच्छी होती है, और बेसिकली यही टेक्निक से आजकल किया जाता है। ऐसे ही शोल्डर्स में भी लिगामेंट्स रिपेयर कर लेते हैं, डिसलोकेशंस रिपेयर करते हैं। सो प्लस और भी इंडिकेशंस हैं आर्थ्रोस्कोपी की, तो ये सब किया जाता है आर्थ्रोस्कोपी।
So not doing a major surgery, yet doing a major work actually.
Yeah, that's
So
right.
it's like that. The other day, Yatinder, I was asking you about a friend's issue regarding the tear of the anterior cruciate ligament in the knee, and you advised कि अगर young आदमी है और उसको knee अपनी काफी यूज करनी है तो obviously आर्थ्रोस्कोपी करनी ही पड़ेगी। अगर if he was in older age group और नी की ज्यादा यूसेज नहीं करना पड़ता, कोई ज्यादा एक्सरसाइज वाली चीजें नहीं करनी पड़ती उस एज में, तो यू कैन गो कंजर्वेटिव। बट इफ समबडी इज यंग एंड ही इज गोइंग टू यूज हिज नी, सो रादर देन बी फियरिंग कि मेरी नी थोड़ी सी भी ट्विस्ट होगी तो मेरे को फिर एक्यूट इलनेस हो जाएगी, तो योर एडवाइस वाज दैट इफ इज अ यंगर इंडिविजुअल उसको आर्थ्रोस्कोपी की जरूरत है, लिगामेंटी टियर हो गया है, तो you should go in for arthroscopy. This is what you advised me the other day.
Yes, generally ligaments tear होता है injury से, either sports injuries, or sometimes even people getting injured while running, or accidents of course, but even domestic injuries like going down the stairs, jumping little bit, एक step miss कर दिया, knee twist हो गया, dancing. Many people come to us that they go in the parties dancing and they at that time they may be slightly more high also, or knee twist हो गया.
Yeah,
so
that's a very common problem.
Yeah, उससे ligaments फट जाते हैं, और young लोगों में अगर फट जाए ligament और cartilage भी फट जाए, तो then they get a very common problem of instability. Instability means उनको लगता है कि अगर वो थोड़ा भी डांस करेंगे या ट्विस्ट करेंगे या भागेंगे या दौड़ेंगे या चेंज करेंगे अपना सडन पोजीशन, their knee will buckle. So buckling of the knee is not accepted even in day to day life. So अगर day to day life में भी young लोगों को ऐसा हो रहा है, तो उनको स्पोर्ट्स में तो जरूर होगा, तो उन लोगों को हम एडवाइस करते हैं लिगामेंट सर्जरी, एंड along with that exercise is also see, ऐसा नहीं सोचना चाहिए कि भाई लिगामेंट ठीक हो गया तो हमारा सारा काम हो गया. Half the part is ours, लिगामेंट ठीक करना, और एक्सरसाइज रिहेबिलिटेशन करना बहुत जरूरी होता है, अदरवाइज लिगामेंट सर्जरी का बहुत ज्यादा फायदा ना हो. So young people require this kind of surgery. Older people, older means middle age, beyond 50, 55, who are, whose job is basically just sedentary job, not playing too much of sports. They can live with a broken ligament, provided they do exercises.
Okay. And I have a question from our viewer. She's asking, what are the benefits of joint replacement surgery and how long it takes to heal completely?
See, joint replacement is done for only one problem, and that is pain. If a person can't walk, in cases I'm talking about in cases of hips and knees, then they would require, if the pain is coming from the arthritic joint, which a doctor diagnoses. Many times, pain in the knee can be due to so many other reasons. It can be just inflammation, like Dr. Sandeep Upadhyay said. It can be early, rheumatism, inflammation, but the joint space is still maintained. Now, those are not the people who would require joint replacement. So, joint pains can be due to many reasons, and therefore, first and foremost for the patient is that they should consult a doctor, their doctor. Okay. And the doctor's job is to find out whether the pain is because of the arthritis, and arthritis also such a bad arthritis that it requires a joint replacement. Then, of course, a joint replacement will help this patient quite a lot. Almost, the pain goes away completely. A mild amount of pain which remains is because of weakness of the muscles, ligaments, bones, maybe sometimes overweight. These are the things which remain. But then 80% of the pain goes away and their quality of life is much better. and they are able to come back to their normal life in about 3 to 4 months' time after the surgery.
Thank you.
Any more questions, Rashmi?
We have covered a lot of things, and our list is too long. I think so.
it
We
was
have to invite them one more time on our show because
yeah,
ये
it
show तो
was
बहुत छोटा है.
it was
हमारे
a
पास list
wonderful
बहुत
program.
लंबी है questions की.
Yeah, I think it was a wonderful session
Yeah.
with both Dr. Yathinder and Dr. Sandeep Upadhyay, and a lot of new things and very simple things were explained to the lay people in their language, and I hope they have taken home very nice messages from this discussion today. I might like to wind up now. Thank you so much, Dr. Sandeep Upadhyay and Dr. Yatinder Kharbanda for being here with us. And it's been a wonderful program today. And thank you so much, Rashmi, for being such a lovely, great host, as always.
Thank you so much, Doctor, and thank you so much for bringing more awareness that health is wealth and work is your priority, but never neglect your health because end of the day, if you are healthy, then you can be wealthy ASAP. So thank you all.
It's become all the more
Thank you,
apparent in
guys.
Yes.
COVID times. In COVID times,
Yes,
health is wealth.
absolutely.
People had forgotten that. Yeah.
In the end, I would only say one thing: that eat half and walk double.
Yeah,
Exercise.
Great.
awesome. That's
That
a
is another take
wonderful
home message.
tip from Doctor, of course, and thank you so
But
much.
but
And
whatever you eat good healthy food.
Yeah,
thank you so much. Thank you so much.
absolutely.
Thank you.
That's a
Thank you
very
so
valuable
much.
suggestion
Thank you.
for our viewers. Thank you so much, and I would like to thank you on behalf of our viewers all over US and Canada, and of course, viewers. We all know Apollo is one of the best hospitals in India, and we are having doctors from there. Thank you so much, doctor, for your time and giving information to our viewers. Thank you so much.
Thank you.
Thank you.
Thank you. Bye-bye.